Hello everyone, welcome back to ER. Today we are going to talk about the coronavirus, the COVID-19. We are going to talk about the treatment, management and precautions that are related to the coronavirus. So what is coronavirus? That is COVID-19. Coronavirus is a type of RNA encapsulated viruses. Encapsulated, they have a very slimy film around their structure and they are RNA in nature. They have previously responsible for the SARS and MERS outbreak, SARS for severe acute respiratory syndrome and Middle Eastern respiratory syndrome. The recent outbreak that have devastated the world occurred on 31st December 2019 where they isolated the virus for the very first time. It is the family of SARS-CoV-2 virus. And now it is converted into COVID-19 and this is a global pandemic now. Every country is suffering from this infectious disease. So what is the major concern these days? The major concern these days is the treatment and it's causing a global panic. I mean, this virus has not caused many deaths. It's a very fair type of individuals that are infected with this virus and a very few deaths. But the major concern for the panicking of the whole world is we do not have any proper treatment available for this right now. This is a very scary thing for some people. The researchers are trying their very best to find some vaccines, and some vaccines are also in development, but we're not going to have the vaccine like in at least for another year, probably in 2021. So if you happen to come across somebody who is suffering from the symptoms of COVID-19 and he's tested for COVID positive, what can you do to help that patient? There are a number of things you can do to ease him up and increase the chances of survival of that patient. So what I think, the treatment, we have to manage that patient and we have to manage it with symptomatically and systemically. We can also give the medications and we're also going to use some supports. So how the course of this disease COVID-19 is progressing. First of all, there is a fever for like consecutive for like 4 to 5 days, and then the cough and the flu appears, and after that, if it persists and it gets worse and over time, and you suddenly feel that you are out of breath, you feel the shortness of breath, and then the pneumonia-like picture appears, and it is very devastating at that point. So a lot of things that we can do for managing this patient. For example, we can use antipyretic drugs. As I told you, there is a consecutive fever for like 5 days. We can use Tylenol for this patient. It is an antipyretic drug. And then to prevent the virus completing its cycle, we can use remdesivir. It is a drug that that blocks the pathway in which the virus reproduces. Then we can use another drug, chloroquine, also available as hydrochloroquine. Is an anti-malarial drug for previously used, and it has proven very effective in treating the malaria. It has also proven to show some efficacy in some patients. Then we use another drug that is called ritonavir. Ritonavir is an also antiviral drug, and it is used. It blocks the different enzymes that are present into the bacteria on the cell that helps the uh, virus complete the cycle. Then, as we know that when virus infects the lungs, it causes excessive inflammation, and that inflammation in it destroys the respiratory membrane and decreasing the overall exchange capacity of the patients that are suffering from the COVID-19. So we can use tocilizumab. Tocilizumab Tocilizumab is a drug that is a interleukin 6 that are the mediators of inflammation. It blocks that mediator and it decreases the chances of inflammation. Then we use corticosteroids. Corticosteroids are very dangerous to use as they lower all the overall immunity, but they can also be used to decrease the inflammation and maintain our respiratory membrane intact. The vaccines, as I've told you, vaccines are in progress, and but we are not going to have a vaccine in like another 1 or 2 years. In China, in the Wuhan, the city of Wuhan, where this virus originated, they developed a drug that is favilavir. This drug has proven and shown, and it is also at proven at some level to show efficacy against this disease. Now, as I've told you, this patient presents a picture like pneumonia and adult respiratory ARDS. We can prevent this patient, we can help this patient by mechanically ventilating their lungs, like doing the effort there the lungs are going to do, and we can do the effort on our side, and we can prevent this patient. We can use different methods. We can use some, what we have to use those methods that decreases the tidal volume, and in return we have to increase the heart rate of that patient. The logic for this to do that is so that we do not damage the healthy lung if we are going to use the method that increases the tidal volume. So we don't want to rupture the healthy lung, so we're going to use the methods that have the low tidal volume, increase heart rate, and those methods that keeps the damaged alveoli open for that can be expressed at the methods that have the positive value of the peeps. The prevention is always better than cure. Precautions are always better than cure. We can wear N95 mask when we have to go outside, or when we are with somebody who has the symptoms of flu and cough. Avoid close contacts. Do not go near people. Do not isolate yourself. As you know, there is a whole worldwide vacations, and the worldwide vacations is gonna, we can use them to get some time for ourselves and avoid people, avoid going outside. It is better to stay in the houses. If your symptoms get worse, and get yourself tested for COVID-19, and if you are tested positive, go to your nearest hospital and start getting your treatment. Always use, always wash your hands for 20 seconds every time you feel like washing your hands, like every 2 hours or every 1 hour. Wash as often as you can. Carry hand sanitizers with yourself. Use foods that are very good in boosting your immunity, because at the end, right now these days, the only that is going to help cure this virus is your self immunity. So get immuno booster foods, get a nutrition, take a lot of milk, get bananas every single day, get foods like this. So if you have any follow-up questions regarding the coronavirus or any myths regarding this of the COVID-19, drop down in the comments, and I'll try to inform you. There are a lot of misconceptions these days regarding this virus, but I'm here to help you out with these misconceptions. Thank you very much for watching. ER.